Hello, and welcome to the Empowered Voices podcast. I am Megan, and with me is my co host, Kelly. Today, we are speaking with Dr. Michael Morse. Dr. Michael Morse is a naturopathic doctor. He's received his medical training from Sonoran University in Arizona. So, hello, thank you for being with us, Dr. Morse.
Oh, hello, thanks for having me. It's great to be here.
Hey, so can you quickly define what a naturopathic doctor is? Because I have so much
Yeah,
respect.
yeah, sure. And I know not everybody knows what they are. So, naturopathic doctors, so essentially we're trained in both Western medicine and sort of functional, integrative, holistic medicine. We go to 4 years of medical school. We do all the rotations, clinical rotations. We do a lot of didactic science courses. And the idea there is that we get a whole comprehensive education, including nutrition, many more hours than like an
Mhm.
MD or DO would receive. And then after that, of course, we're allowed to sit for the boards. There's two board tests, one after 2 years and one after 4 years.
Mhm.
Um, and if you live in a state where it's licensed, then you can try to get licensed after you pass your boards,
Mhm.
apply for licensure, and then be able to practice medicine. So it's this really unique blend of sort of traditional medicine mixed with conventional,
Yeah,
um, which I think is very approachable for a lot of
I
patients.
do too. I think you do a really good job of getting to the root cause of things with the.
Yeah, that's actually in one of our six tenets, which is to treat the whole person and get to the root cause of the condition, rather than just treat symptoms.
Well, thank you for sharing. So we all experience general stress and coping, kind of go along with our emotional health topic kind of for today. For someone that's been experiencing intense, prolonged stress, like our listeners, what are some of the most common physical manifestations you see in your practice?
So, yeah, that's a really good question. So, clinical manifestations of stress, I'd say some of the most obvious ones are going to be things you can see, and then things, of course, that are going to affect you systemically. So, first things that you can see would be like acne might be showing up or rashes. But then systemically, sleep is going to be the biggest one, right? You're going to be having trouble sleeping from that high cortisol levels. And really, it's that cortisol stress hormone cascade that really causes all of this. So, cortisol keeps your uh, melatonin from functioning properly, so you can't sleep well. You're going to have also adrenaline is another stress hormone that happens, and that suppresses the immune system, and that's where the acne comes from. You're not fighting off things like you should be, and then you're also more likely to get sick. You might get like a sore throat or an infection of some
Mhm.
sort, a upper respiratory infection. So all these things, basically, your immune system's going down. You're not sleeping well, so you're not resting. You're not rebuilding all of your cellular infrastructure, um, and so it's just coming out as this cascade of symptoms, basically,
Mhm. Mhm.
which I'm sure we've all experienced, right? I mean, everybody everybody's listening to this has probably been stressed at some point in their lives, so they know what that feels like.
Yeah.
Um, the real question is, how do we combat that,
How do we
right?
combat that? And you have been through some pretty challenging times in your life with stress and some of the things that you've personally had to go through. And so you can speak at from a doctor's standpoint. And would you
Yeah,
mind
absolutely. So when I
telling us
was,
about those things?
yeah, absolutely, I love to. So when I was a fourth year med student, this was, gosh, almost 10 years ago now. My son at the time was diagnosed with brain cancer. And this is with a previous marriage of mine. And we went through treatment with him, basically living at a Phoenix Children's Hospital for about 8 months. Treatment lasted about 11 months, and unfortunately, he didn't make it. But during that time, it was incredibly stressful trying to just not only deal with my child, who was 6 months old when he was diagnosed, so already just a brand new parent, and then having to deal with cancer treatment on top of that. and neurosurgeries, all of that. And he was an incredible fighter, and he did really well during it, but unfortunately just ended up succumbing to the disease. Um, but yeah, during that time, really, I think what was fortunate for me in that situation compared to many maybe of your listeners is that during a cancer journey, you generally are really well supported by the community. And so I was very fortunate that not only my friends and family were there for us, but also my school, the administration was incredibly helpful during that process, and just allowing me to do what I needed to do to be able to graduate on time. So that was very fortunate. So to extrapolate that to your audience, maybe is to maybe say that reach out to your community as best you can because they will be there for you. Everybody knows that going through a divorce or going through, a court battle like that is incredibly challenging. And it's not that you have to, be in a cancer battle to receive that kind of support. Um, so that taught me a lot about going through incredibly stressful times and what it takes to really receive support from your community, but also receive or to give yourself support and what self support looks like and self care during those kinds of times.
Thank you for sharing that. And your son is very proud of you. Um,
Thanks.
so, so I know many people have been through so many horrific things, just like you spoke about, and you thank you for giving those, ways. You know, I think a lot of us forget about community and just finding a support system. So thanks for bringing that up. And like you did
Yeah,
say,
super important.
um, even though you don't have to have cancer to seek that type of support. So,
Right.
so my next question is, we often hear fight or flight, right? Not rhyming today. How can someone recognize when their nervous system is chronically activated, and what are some of the strategies that you know to regulate it?
Yeah. So, and actually, that's a good point you bring up too, because actually it's fight, flight, or freeze too, and that last one's really important because when you're in an extreme situation like that, freezing might be your coping mechanism, and that might present as an inability to do what you need to do in your
Mm-hmm.
day-to-day life. And maybe that is what's preventing you from the self-care. Maybe it's preventing you from showing up for your children, maybe.
Mm-hmm.
Um, and so that one can be harmful too. Um, and it's really going to be treated the same way as fight or flight, right? Because those are all coming from high levels of cortisol, high levels of adrenaline, epinephrine. That's preventing the normal functioning of our system, of our brains. So really, it's all about just trying to get back onto the normal course of your metabolism. So, what does that look like? And it's hard because you can't just say, "Well, get better sleep," right? Because
Yeah.
it's
Mm-hmm.
preventing you. These
Can't
hormones are
guarantee
preventing.
that. Yeah, I can try, but
Yeah,
work
it's
at it.
preventing you from sleeping. So you have to kind of do what you can, just super baby steps. Remind yourself, are we taking this day by day, or do we need to take it down even further? Or we need to get like minute by minute here,
I
and
like
just
that.
just try to get through it. Just get from 1 minute to the next, 1 hour to the next, um,
Take
and
it.
just baby steps physically. Maybe that for you looks like getting out in nature a little bit, just taking a walk,
Mm-hmm.
calling a trusted friend or family member. Just the idea here is to just get your stress hormones down.
I really
Um,
like that. And so
and
would you
yeah,
suggest like breathing on walks as
yeah,
suggested,
yeah,
mindfulness
yeah. Breathing exercises is good. And the idea behind breathing exercises is when you're stressed, when you're high epinephrine, high cortisol,
Mm-hmm.
your body's natural tendency is to breathe fast, right? Because that's ancient mechanism of
Yes.
like I need to run from a tiger. But
Yes.
obviously that tiger's not there. The tiger is your ex or the court. And so the idea there is you want to be understanding what your breath is doing. Breathing exercises are great, but if you don't understand why you're doing them, you're just gonna be like, "Ugh, fine, I'll do some breathing exercises."
Well, yeah, I was going to say, how do you differentiate when to use it or anything? So yeah, I
Yeah.
definitely think, the
So
thing.
when you're hyperventilating, just to talk about the physiology of it all real quick, when you're hyperventilating, you're expelling too much CO2.
Mhm.
And so when you do that, it disrupts the pH balance of your blood. And so you're expelling too much acid, so your blood's becoming too basic, and then your pulmonary vessels start to constrict, and that's where that chest tightness comes from.
Ooh, I
And if
see.
it starts to get too much, your blood starts to get too basic, it changes the way your brain works, and then your cognition changes, and you feel like you're just maybe in a tunnel a little bit. It can kick into a panic
Yeah, I
attack
was gonna.
because of the physical chemical changes in your blood. And so sometimes if you're really in the moment, just like hold your breath. You want to stop expelling all that acid, all that CO2.
Thanks.
And that can really turn you around. Then you can realize, oh, I've been hyperventilating. If
Hmm,
holding your
hmm.
breath for 20 seconds is suddenly making you feel better.
So,
So that can be
yeah, I
that can be
think
a big one.
breathing is key. I don't know about you guys, but sometimes if I'm just really stressed up, I forget to breathe.
That's another one. Yeah. Definitely do
Like
that.
Megan, when was the last time you took a deep breath? So you bring up these excellent points, and these things are
Yeah.
things we should be doing
Yeah.
daily. It
So the
just
breathing exercise is good because you can either hold your breath for 20 seconds, or if you're a breath holder, you can focus on just doing long breaths. You should breathe out twice as long as you're breathing in, and that usually can get you right back on track to getting at least your blood pH back to normal.
some thank you. So when someone is dealing with constant court battles and emotional turmoil, how important is it to prioritize your health care, and what does that look like in practical terms?
Did you say
Yeah.
healthcare? Sorry.
Um,
Self-care?
self-care.
Oh, self-care,
Hmm.
self-care. Yeah, yeah. So, and I know that like a lot of people probably tend to reach more for maybe substances, maybe a glass of wine, maybe some marijuana or something. And to that, I would say it's tough because you want to escape, right? Because you're just constantly in this onslaught, and substances are an easy way to escape, right? But maybe would be to a better way would be to find a different way to escape. Maybe, with everything in moderation, right?
Hmm.
So what does that look like for you? Maybe it's movies. Take time for yourself to just watch a show at night.
Hmm.
Have a time for yourself at night where you can just start to relax, wind down. Um, not a screen too late, of course. You don't want to be watching it right up until bedtime, but between that 7 and 9 p.m. hour of where you just are allowing yourself to just kind of be somewhere else for a
Hmm.
little bit, and just wind down, whether that's a book, video game, movie, TV show, whatever. Um, or maybe it's a walk. Maybe
Yeah.
you take a walk. Maybe you go
Awesome.
exercise. Maybe you lose yourself in some exercise. Personally, for me, it's hard for me to relate to that a little bit because when I was super stressed, I'm naturally just go for like I don't even want to eat. If I do eat,
Yep.
it's going to be a salad. I go exercise. I run myself to death. I don't want to get too morbid, but when I was deep in it, I was really running like every day, and I was just like, I hate running, by the way, and it's like,
I,
but you feel like death sometimes, and you're like, you know what? If I die, it's fine, and that allowed me to push myself to an extent that actually worked, and to a point where I can't really do that when I'm happy because I'm like, I don't want to die right now. so,
I don't want to die.
so if you're feeling suicidal, just go for a run,
Yeah.
and that'll usually feel a lot
I was
better
gonna say,
when
at
you're
least
done.
you're getting, those healthy chemicals
Yeah,
going in your
yeah, you're getting
day.
endorphins going, you're feeling better, you're actually clearing the cortisol out of the synapses and the epinephrine that builds up
Hmm.
when you exercise. It actually flushes it out, so it does help you in the long run.
A question about sleep.
Yeah.
So, is there an ideal time frame of going to bed? Because I'm a bit of a night owl and I don't go to bed till like 11 or later. And I
Yeah.
remember reading somewhere where your HGH is at its highest while you're sleeping, I think between like 10 and midnight or something. Like, is there an ideal time?
Yeah, that's a great question. I do a lot of work with circadian rhythm too. And a lot of studies show that even though, I mean, you'd have to have impeccable sleep hygiene really
Mhm.
for this not to be true.
Hmm.
But in our normal society where the sun is still getting up and you don't have blackout curtains, if you spend, if you go to bed more often after 11 p.m., you're more likely to end up with some sort of metabolic syndrome or diabetes in the next 10, 20 years than if you go to bed pre 11 p.m. And, our circadian rhythm really dictates everything in our body. All of our cells have to link up on the same time frame. Um, and so I'm a night owl too, and it's tough. Um, and there's all kinds of tricks you can do, right? There's all kinds of things you can do to manage light levels, make sure you're not getting exposed to too much blue light at night. So make sure you've got like that night filter on most of our phones have it nowadays. So make sure you have that turned on. Um, and I even go a step further. I have a pair of orange glasses. I don't think I have them right here, but I wear orange glasses. They're like
Oh,
safety
I
glasses.
know those
I've
glasses.
seen those.
I know
Yeah.
what you're talking about.
Oh yeah. Yeah, I'm all about those. But they're great and they cut out all the blue light spectrum. And so you don't have to worry about being exposed. So you put those on 2 hours before bed and you'll actually just naturally start getting tired. It's really good. And on the other side of it, when you wake up, you want to turn on the daytime circadian rhythm part. So within the first 30 minutes of waking up, you want to expose yourself to really bright sunlight for 5 minutes. I always recommend going out and sitting with the sun with your coffee or something. Then, of course, eating. This is tough with time restricted eating diets, but if you're not doing a time restricted feeding schedule, then eating within 30 minutes of waking up is a really good way to tell your entire body, like, it is now daytime, I'm breaking my fast. So that's a good one to deal with jet lag too if you're going
So
traveling.
people who do like intermittent fasting, because I've done that, and I wait until like 1 p.m. to eat.
Yeah.
Is
Yeah, so you
there,
just have to rely on the light exposure, um, and even exercise can help in the morning too to deal with that. You want to get that cortisol spike. So cortisol, we do need that. It's a good thing, but you don't want to be living in a state of high cortisol all day.
That's when it
Some of the
becomes.
testing that I do for that is a 4-point salivary cortisol. So you spit into a test tube like in the morning, at noon, 6 p.m., and then bedtime. And then we get a nice little graph to see. And it's supposed to be high in the morning, a little bit of a dip at noon, and then it just tapers down through the rest of the day. And by doing that, we can see, are you living in a high cortisol state? So that's kind of like the early stages of stress. Um, but if you're in that fight or flight too long, what'll happen is you'll have low cortisol in the morning or low cortisol. It might be flatlined all day, which is sort of what we used to call adrenal fatigue, but it's just basically your body's not functioning anymore. And when cortisol's not there supporting you, what's there supporting you instead is just epinephrine.
Well, nuts.
And so you're more prone to anxiety, more prone to panic attacks, all that. So
You do a great job at explaining things.
thanks.
Hey, Miss Kelly.
yes, so going along with eating habits,
Yes.
stress can impact it, like you said. For you, you said you don't eat. For me, I am a bit of an emotional eater, and it's typically like gallons of ice cream at a time.
Yeah. We've been
At like
here and there, honey.
midnight, just sitting there while
Yeah,
everyone's asleep, just eating my ice cream, being like, but
yeah.
clearly that's not healthy.
Yeah, well,
So,
that makes sense too, because cortisol does make you crave sugar. Because when you're in a fight or flight, you're in a war situation, you just need quick, easy access calories. Uh, I don't know, for whatever reason, some people like myself, just when cortisol's high, it just shuts off my appetite. I
Same.
can't even stomach
Same.
it. Like it'll make me nauseous if I eat something too much. So I just literally can't. I know some people are like that, and in that case, you just want to reach for protein bars. Really, in anybody, if you're an overeater or an undereater, focus on protein. Focus on just getting good quality protein. If it has to be a protein bar, so be it. Just make sure it's not super sweet. Eating lean chicken, just something to get protein in your body. That'll go
do
a
you
long
know
ways.
what makes some people go one way, like not eating, and then others go the other way of overeating?
That's a good question. I'm not really sure why some people are like that versus others.
It's not probably.
I
Yeah.
naturally always crave sugar, so that could be why it just like
Yeah.
compounds on it. I don't
Yeah.
know.
Kelly and I, this is a great topic because we're going through a little bit of a health change in our lives right now. So this is good. Working out.
Nice.
Yeah. So, what are some key nutritional considerations for supporting the body during periods of high stress?
Yeah, so we touched on the protein a little bit, but you also want to focus on micronutrients. So if all you can stomach is like a piece of chicken or a chicken sausage or something with a smoothie in the morning, then do that. Try to grind up some greens, some fruit, and put it in a smoothie. Just something to get some of those electrolytes, some of those antioxidants to support you while you're going through all that.
Are there any specific foods or dietary patterns that can help to mitigate the physical effects of stress? I know
Um,
magnesium can help a little
yeah,
bit with the calming.
yeah, magnesium is great. And magnesium, there are studies that show magnesium, you urinate out a lot more of it when you're under stress. So not only
Mm,
do you need magnesium to help calm down, you're actually actively losing it.
bleeding. Yeah, getting,
Yeah.
Yeah,
yeah.
And aren't
yeah.
most Americans already deficient in magnesium?
Yeah, yeah. So our soils are pretty depleted in magnesium as it is. So it's tough to get it naturally from a diet unless you're really just having a bunch of dark chocolate or something. So I always recommend supplementing magnesium. And if you have a frank magnesium deficiency and you're not under stress, you could still end up with an anxiety disorder. So it's super important just to be calm as a baseline. So
What
definitely want to
about
make
the
sure.
different forms of magnesium? Because I know there's like threonate,
Yeah,
glycinate.
yeah. So that depends on whether you're. So I usually talk to a patient about their stools. Are they having more constipation? Are they
Hmm.
more prone to diarrhea or softer stools? And that'll inform which form I go for. So starting from the most basic, magnesium oxide, that one's not very bioavailable, so I don't usually reach for that one, but if they are super constipated, that might be the way to go.
Hmm.
Um, and then the next level up would be like magnesium citrate. That one's probably my favorite because it's the sweet spot of cost versus effectiveness. And that one is good for it's easily uptaken by the brain and the muscles. Um, and it only causes moderate stool loosening. So if you're kind of in the middle there, that one's fine. Or even if you're constipated, that one you can take a little bit more of it and still have it be effective. And then some of the more expensive ones where the magnesium's attached to like an amino acid,
Yeah.
like magnesium threonate,
Hmm.
magnesium glycinate. That one's kind of closer to citrate, but threonate is really good for the brain and much easier on the stomach. So if you do have more tendency towards diarrhea or softer stools, then magnesium threonate is going to be the way to go. Of course, it's much more expensive than the other ones.
It's good.
Yes, we do glycinate every night.
Yeah,
But I was looking into the threonate just because starting to get older, and my family has a history of dementia and Alzheimer's,
Mhm.
yeah,
and so trying to keep the
yeah,
brain going as long as possible.
right.
Absolutely.
Yeah, that's a good one.
Let's see. So with the supplements, like what we just talked about, magnesium, are there any other specific vitamins, minerals, or herbal remedies that you find beneficial for supporting the nervous system and overall well-being?
Yeah, yeah. So there's this whole class of supplements and herbals that we call adaptogens.
Hmm.
And so those are something that you really want to consider if you're going to be under a long period of stress. So that would be things like ashwagandha is probably the most well-known and most popular. That one is really good for kind of acute anxiety, but also chronic anxiety. It's really more for taking long term.
Hmm.
Um, and so that one's really helpful to just manage your stress levels over time. Um,
So I read somewhere that you should only do it for like 6 months at a time.
Yeah, I usually do like about 12 weeks, but the benefits are you're not really going to see a ton of benefits like on the first dose, for
Hmm.
example. It's something that has to build up in the system.
Right. Okay.
Um, that's what I meant. Yeah. It's not you don't want to take it forever, but yeah, you
Right.
do want to take it in cycles, basically. Hmm.
Michael, what was that liquid stuff that you once gave me that would help with anxiety or that
Yeah,
got
so
from you?
that one's more of an acute uh remedy. So that one wouldn't really help you adapt to stress. It would help you calm you down in the moment. So if you're having like a panic attack or just really high anxiety that day, so you've got a court date coming up or something,
Hmm. Hmm.
that one's passion flower. So
Okay, passion flower. I knew
yeah,
it. I got
that
that
one's,
labeled
yeah,
written down. Yeah.
that one's my favorite. So that one is really good at calming you down, but not making you
No,
too drowsy
no,
and not bringing you below
it's
where you need to be.
yeah,
Yeah.
it's a great
It just brings you back down to
remedy.
baseline. And so that usually comes as a tincture. So it's a liquid. It comes in either a alcohol base or if alcohol is a problem for you, it comes in a glycerin
Mhm.
base. Um, and you just take like 2 to 5 dropperfuls and it's great.
Cool.
and can help with sleep. Kava is another good one for that. Kava root extract. So that one's really good. Help you sleep as well. All those herbs, kava, passion flower, valerian root, chamomile teas, those are all great. Those are all in the moment sort of treatments. It's the adaptogens like ashwagandha, ginseng,
That are
some of
over
those others.
time. Yeah.
Yeah,
Okay.
those are more long term,
Okay.
give you support over time.
What about like essential oils?
Yeah, for that, I'd probably reach to lavender for that one.
Mhm.
Lavender actually has some serotonergic activity, similar to an SSRI, even if when you just smell it. So that can be calming just from putting some on your pillow, or if you just need to bring a little bottle with you to sniff for a little bit. That actually does have some serotonin reuptake inhibition just from the act of smelling it. So that can be nice. It also comes in pill form too. I think it's called Levangela or something.
Isn't it good for
So you can actually eat it.
Inflammation?
anti-inflammatory things as well?
Anti-inflammatory.
Yeah.
Um,
I don't.
I'm not sure exactly. I'm sure it does a little bit. Yeah.
Okay. Yeah,
But
not the
yeah,
first
taking it by
option,
pill
but
form
just
can
some
be,
rant. Okay.
yeah, I wouldn't reach for that just for anti-inflammatory properties.
So
Yeah.
knowledgeable.
How can someone make sure they're getting the right nutrition when their life is super chaotic? Sometimes it'll get to 3 and I'm like, have I eaten today? You know?
Yeah, for that, you probably want to just try to do routines, or if you really need to, put some alarms on your phone. Um, and really, you also can't disregard a good supplement regimen. If there's anything you can do, just making sure you're eating your macros, plenty of fiber and protein, and then get a good multivitamin, fish oil, magnesium pill on board, vitamin D, K2. Those are also really good to have. Just foundational supplements really is all you need, because supplements these days are crazy expensive. You
Well,
get
they
that.
Mhm.
are. I'll tell you one
Yeah.
thing
So,
though. Fish oil. I love fish oil. It helps with
yeah,
so many things. Like when I take
yeah,
it, I mentally feel better and then my joints feel better. Just fun fact.
yeah. I love fish oil
That's
too. It's
great.
like makes your brain a well-oiled
It
machine. It makes your
does.
fingernails stronger. It makes your hair better, your skin better, your
Nails.
eyes better.
Yeah.
Not that you care about that, but we do.
I like the Fatty 15
Mhm.
product.
Mhm.
That's a really good
I don't
one.
know if
They
I
have a
know
lot
that
of good
one.
research.
Yeah. Yeah,
So,
I like Nordic Naturals. Those are my favorite. Yeah, the Omega 2000. It's like the most dense one. You want to look for a fish oil that's like EPA, DHA. If it just says omega 3s
And
and then
it's,
it's got a tiny amount of EPA, DHA in it, that's not good.
yeah.
They're not purifying it for you to the it's the EPA and DHA. That's the only one that matters. When we say omega 3s, those are the only two that matters. You can get ALA, but that's going to be uh, converted at a rate of about 5% in the body.
Okay.
So if you're trying to get your omega 3s through like flaxseed, it's not going to be
Not
very
gonna
efficient.
work. Yeah. Okay. Well,
yeah, I like to eat chia pudding. That's got some a decent amount,
It's got
right?
some in it. I like chias just for the mucilaginous stuff on it. That's good for the gut. It can be healing. And then also the fiber is really
yeah,
good
that
in
fiber is
chias.
good. Yeah.
Yeah. Yeah, I'm on a huge fiber kick right now, not only for myself, but just for outreach, telling everybody because we have a major fiber epidemic in this country. We do
We
not get enough
do.
fiber.
We don't.
And women are supposed to get 25 grams per day. Men are supposed to get 38 grams per day. And if you actually look at like an amount of like broccoli that you'd have to eat to even just get like 4 grams, I mean, it's crazy.
Yeah.
So you really
And
got to just be having lots of
yeah,
veggies,
I
fruits with everything.
remember, I don't know if I read it or saw it somewhere, but they say just even a small increase in fiber and your, the probability of losing weight increases substantially.
Hmm.
Yeah,
Hmm.
yeah. Yeah, and prebiotic fibers are really good too. That's the ones you want to reach for. So things in like jicama, artichoke, what are some other good ones? Inulin, those prebiotic fibers, they feed the gut microbiome.
Hmm.
And
Hmm.
when you're under stress, you need a good microbiome too. That's really considered another organ in itself. And
Right.
so if it's going to be starving along with you unless you're feeding it the food that it
That
likes,
it
which is
needs.
those prebiotic fibers. And
Yeah.
that can go a long way in keeping you calm and stress resilient too.
Right. And I learned that the microbiome your gut is where your
Serotonin. Sorry.
yeah, that's
I
produced,
got
and that can cause like
excited.
Yeah,
leaky
it's true.
gut or whatever can cause be part of your depression and anxiety, and just fixing your gut can help with that.
Yeah,
It's crazy.
absolutely.
I for so long I had that. I'm like, oh, it's up here. I'm like, no, you're most your 90% of your serotonin is in your stomach. Fact check the
Hmm.
90%. But yes. I was like, I think I learned that out. I learned that when Joshua, my brother, got really sick. And I was like, oh.
Yeah,
So
yeah.
beyond diet and supplements, are there, so we kind of went into this, but the physical therapies or modalities like massage or acupuncture that can help for managing stress and promoting relaxation.
Yeah, and those are all great. Anything that can promote relaxation, if you have the money to do it. I know these things all cost money, but
Yes,
I also know when you're
yes.
dealing with these things, when you're dealing with a court battle, things can get, money can be tight. Um,
Oh,
and so that's where,
that's
so,
what Kelly and I are
so I'm
doing.
all about,
We've got surprises coming up, but we're all right. For people who are completely drained, what simple, gentle ways can they begin to restore their energy levels? Oh, yes, this is important.
yeah, so that kind of touches a little bit about what we were mentioning earlier, and that's just doing first what you can handle. So if that looks like you mentioned massages and acupuncture, those are great, but of course, if finances are tight, which they usually are during a court battle,
Yes.
you'll have to do what you can on your own, and maybe that looks like just spending time with a friend, just talking it out. This can be super helpful, a trusted friend or family member,
Mhm.
going on walks, exercising, um, and just trying to find yourself, because when you're extremely stressed, it's easy to kind of forget who you are at times,
Yes.
especially if you're ending a relationship and you were in this relationship for a long time, and
Mhm.
this is who you were,
Yes.
and then suddenly it's just you, and you may not even know who you are. You're on this
Right.
island alone now, right? So not only are you having to deal with like a battle, but you're also like, who the heck am I?
I can
So it's
relate
hard to
to
even
this.
figure
Yeah.
out.
Yeah, this is
Yeah,
very
Yeah,
true.
hard to even
a
figure
lot
out
of
like,
people, yeah, a lot of people who were trauma bonded,
hmm, yeah,
they've given up so much of themselves
yeah,
that when they get out of the relationship, they have to kind of relearn who they are. And sometimes that's actually you, kind of like me in a way, like you become stronger and
yeah,
you learn how strong you really are, and you can recreate yourself however
yeah.
you want.
Yeah. Yeah. And so, yeah, and maybe you're lucky, one of those that like the relationship ended and you're like, finally a breath of fresh air. I can watch the show I've been wanting to watch.
Yes. Yes.
Uh, or, or you may just be totally lost, and that can be really scary too. And so, you definitely want to try to just do what you can. Find a show you might like, or just if that's even too much, just download a really simple phone game.
Mhm.
Gosh, when I was really deep in it, I downloaded like Wheel of Fortune, and I just played that for like hours, just to pass
Hmm.
the weekends, right? Whenever you're there alone.
Yes, my girlfriends. I like animal videos, of like funny animal videos.
Yeah,
My son and
that's it.
I
Yeah.
were always watching those. I watched those through some of the hardest times in my life. I know that sounds silly, but it worked.
No,
It's
sometimes that's what you got
great.
to do.
Yeah, and
Yeah.
anytime I'm like get
Sometimes
out of done with a busy meeting or anything, what do you think I do in the background? I'm on my phone watching animal
he's watching it right now.
videos. So,
Yeah.
so
So that can be.
we've kind of mentioned this, but are there natural ways to support the adrenal glands, which are often affected by chronic stress? And I know we have some things here,
Yeah.
but we've kind of already gone over that. You have vitamin C, right?
Hmm. Yeah. Yeah, really just I try not to get lost in the weeds too much about like pinpointing exactly what nutrient you need, because you really need all of them. I mean,
Right,
we
I know.
talked about magnesium being urinated out during stress, but so are all of your other electrolytes and other micronutrients. And so really you just want to focus on just eating what you can. And
Mhm,
sometimes it's hard, so you just try to take a multivitamin for support.
mhm.
Um, and then if you do want to get targeted, maybe reach for some of those herbals like ashwagandha or ginseng or something like that, to support you over the long run.
Is there a multivitamin that you would recommend? I've heard that sometimes multivitamins have so many things and so little amounts that it's not
Yeah,
really.
yeah. I would say, well, my favorite is as pure encapsulations, multi-TD. So that TD stands for twice a day, not three
Mm-hmm.
times a day for those healthcare professionals out there. So multi-TD, it's a really good one. It's the one that I've tried personally. That I mean, my philosophy is like you should take a multivitamin and you should feel it. You
Oh,
should feel better energy.
absolutely.
Right.
You should feel it. Like if you haven't had it in 5 days, you should feel like you're missing it, like you're tired. And that's really the energy from those, it should be coming from those B vitamins. So it should be pretty good in B vitamins. And then, depending on what else is going on in your life, maybe you need iron. So then you reach more for a women's multi that has a little bit of iron in it. Uh, If
What
you're,
about like B12 shots?
yeah, those are good. So in situations
Yeah.
where you're stressed, bioavailability might be suffering. You might be having an inflamed gut situation.
Mm-hmm. Mm-hmm.
So then you can reach for, if you have a practitioner that does B12 shots, that's great. Those are great. Maybe once a week. Otherwise, if that's not available to you, you can do sublingual B12 that just dissolves under the tongue. And that way it gets right to the bloodstream without having to have it carried from the stomach to the terminal small intestine and delivered that way.
Right. So a lot of our listeners feel isolated and alone from their situations they've been in. You've talked about how important it is to have a support network. What are some ways to find supportive communities or resources? I know our website we've got a few things,
Mm-hmm. We
but is there something that, yeah, that you may recommend?
Yeah, I mean, support groups are great. I always
Mhm.
recommend those. And there's plenty of recently divorced support groups, those kinds of things. Even if you're just going through a breakup, I mean,
Mhm.
go to one, it's still going to be helpful. And you'll find other people that are also, deep in it in the moment. And it's nice to just be able to talk it out. For me, I'm kind of a quieter guy, but when I'm going through it, I'm like verbal diarrhea. Just
I
whoever's
just
gonna,
need this out of my
yeah, whoever,
Yeah.
yeah, whoever's gonna listen that I trust is gonna just
yeah.
get dumped
Yeah.
on. So, but that's like how I deal with it. That's how I process it. So really, you're going through this really tough thing. Your brain's trying to make sense of, what's up versus down. Sometimes just talking it through is how you might be able to process it better. And so whether that's your parent, whether it's a sibling, a dear friend from high school or whatever, maybe it's a stranger in a support group. All those can be really helpful.
Yeah.
And if you can
Yeah.
wing it, a therapist is always a good idea too.
Yeah. The problem with therapy is some don't take insurance and it can get very
Yeah, it can be
pricey,
very pricey.
which I feel like something with that kind of needs to
Yeah,
change. But
yeah. And maybe even a
um,
conversation with ChatGPT. I mean, let's go there. I mean,
There was this one girl that was
right.
like for counseling. She's like, yeah, with this economy, I don't know if you guys saw that reel. And she's like, therapy, there's first thing to go is the mental health. And then she's like, I think I'm going to use ChatGPT to
yeah,
diagnose
yeah,
my. I
yeah,
have a girlfriend that plays around with it. I don't know. But yeah, and
yeah. Now, of course, I wouldn't recommend it for like your health, and even
absolutely
probably.
not. That's, yeah,
Yeah.
no, I just think it's like ideas for
Mhm.
different types of
Yeah,
walks you could do, or,
it can give you it can give you some great ideas, and it's really using the internet at large for that. So if you're using it for like, how can I get over these circular thoughts I keep having, then that's a good question, a good conversation to have, and just talk about it like you would a friend.
yeah, yeah, that,
Hopefully, it'll be there for you.
they will be. They
They usually are.
okay, so what are some practical tips for setting healthy boundaries, especially when you're dealing with high conflict people, difficult people, or
Hmm.
situations? So, just can you tell us kind of the importance
Yeah,
of
yeah.
boundaries, which many of
Right. So now
us,
we're dealing with
yes.
not only your emotions, but someone else's too, right? And so what does that look like? So we can assume the other person's also in some sort of stressful high fight or flight state. And
Hmm.
so we're both in our animal brains right now.
Hmm.
What we really need to do is extract yourself from the situation if you can,
Hmm.
or you can try to do what's called gray walling. You know, if you're
Okay.
dealing with a narcissist, you don't want to be feeding them any kind of
Mhm.
emotional
Yep. No
food, so to
reaction,
speak, that they
just
can use
facts.
against you.
Mm-hmm.
So you just gray wall, and you just, turn it off basically, and not really give them anything to feed off of. Um, and, like I said, assuming they're in a fight or flight state too, that should hopefully bring them down a little bit. If you can't leave the situation, do what you need to do in your own life and focus on yourself. Um, and so,
Boundaries
yeah,
changed my life. I didn't really know about them, ironically, as many of us don't sometimes until I was older in my 30s. And they're so important, to help,
yeah,
just leave. It
absolutely.
lives, great for mental health, just great taking care of
hmm
yourself. It's
Yeah,
self-care.
and boundaries are great for you. And when you're dealing with somebody who's high conflict, usually that can be triggering for them. Um, Not to say that that's reasonable to do, but just understand that that may be triggering in itself. Whether you're dealing with a abusive partner, whether you have bad family dynamics and you're having to set up boundaries with parents,
Mm,
just understand too that they're going to be processing that, and that's going to be difficult for them, but that's not your responsibility, right? That's
right.
their
Well, that's their
responsibility. Yeah.
responsibility. Yes.
Yeah.
So, when someone is feeling completely overwhelmed, what are some small, manageable steps they can take to start feeling better?
Yeah, so when you're really stressed, I get it. It's sometimes it's impossible to even put one foot in front of the other, right? And to say that you need to go exercise or, go for a walk, that can be even overwhelming sometimes. And so that's when you kind of just have to take it back a notch and just remind yourself, like, I will get through this. Take it one step at a time, 1 minute at a time, 1 hour at a time.
Hmm.
And in fact, exercise is probably something you don't want to be doing when you're under chronic stress like this.
Hmm.
And if you are going to exercise, it should just be walking to whatever you can tolerate, because exercise does require some cortisol elevation. And if you're depleted in cortisol, all you're going to do is run
Right.
yourself on
Yeah.
fumes. And so you don't actually want to be doing that. Um, and so if you're completely overwhelmed, just start with what you can control. If you can, walk yourself to the kitchen, get yourself some water, some good quality protein. If you have to order DoorDash or something, do that, or order groceries
Hmm.
so you don't have to leave the house. If you're just completely overwhelmed and everything's too much, call on somebody that you trust, a family member, to bring some food over for you, and just something to get you through today. It's really the main goal.
Okay.
So, what are some of the first steps should take when they recognize they are experiencing chronic stress?
Yeah, so I think by the time you're in chronic stress, you probably don't realize you're in chronic stress
Hmm.
territory. You've just been acutely stressed every day.
Hmm.
And so I think probably catching the stress is probably most noticeable when you're having trouble falling asleep, or you can't stop waking up at 3, 4 a.m. When you normally wake up at 8 or something like that. That's when you know, like, your
Hmm.
cortisol is too elevated. And when your cortisol elevated, you're going to get those earlier wakings because melatonin just can't compete with those elevated cortisol spikes.
Hmm.
And so that's when you should be like, okay, I need to do something. I need to figure something out here. And maybe a sleep aid is what you need. If you need to be zonked out, take a Benadryl or something. I didn't say that. No medical advice here, but something that you can do that your doctor is okay with to help you sleep and sleep through the night, that can help you build up enough reserves to keep you
Hmm.
going. Even if you have to artificially prop up your sleep, that might be something you need to consider.
Hmm.
Um, and
My
some people,
stepdaughter, she's had a lot of stomach issues, and
mm,
I always bring up stress, and she's like, "But I don't feel stress." I'm like, "Well, you don't necessarily have to feel stress
Hmm.
to be stressed."
Yeah.
And she's had all these
mm,
tests done. She finally found out that she might have Crohn's or ulcerative colitis, but stress can do some damage on your body, so
yeah,
you
it
have
definitely
to get that
can.
under control.
Yeah, yeah, absolutely. And sometimes it's impossible. Sometimes you have a lot of external stress going on.
Mhm.
There's different people handle it differently, right? Sometimes
That's right.
people create their own stress, and maybe you aren't in a court battle, and you're just a stressful person. You're just a bundle of nerves all the time because you're a worrywart. But, and to that, I would say those are the type of people that are living in it and don't realize it all the time.
Mhm.
Those are the people that really need to do self-care. But when you have an external stress like that, like somebody's attacking you through the courts or something like that, then it's pretty easy to recognize. Usually you can tell, you can pinpoint
Yeah.
like, yeah, my body is completely out of whack right now. And to that, I'd say don't be afraid to support it where you need to. Of course, see your doctor, see what can be done to help you support that. Like I said, a sleep aid or do a cortisol test, see where your cortisol is at. If
Mhm.
are you at a point where you still have nice peaks and valleys or in a good diurnal rhythm, or are you low in the morning and need some support in the morning, or uh, if you're flatline, do we need support all day? I have colleagues who you know, have a patient who's got a super low morning cortisol and it's not unheard of to actually give a steroid in the morning if it's gotten that bad. That's the type of person that's waking up with a panic attack every morning. And so sometimes corticosteroids, just a light one, can be helpful there to support the adrenal glands.
Wow.
So when someone does have adrenal fatigue, what can you do to help with that?
Yeah, so it took a while for you to get there, so it's going to take a while for you to get out, right? So it's gonna take time to rebuild those reserves and rebuild your whole body really is going to need support here and just to get you out of it. And it's probably going to first take getting out of the acute stressor. So unfortunately, you're just going to have to really support yourself until that final hearing or something,
Mhm.
until there's some sense of resolution, and then you begin the process of building back. But until then, you're just really going to want to hit it hard with support and really probably get somebody on board to help you with that because it's hard to do self-care and it's hard to treat yourself. Like for myself, I can't treat me or my family members. I'm too in it.
Mhm.
You have to reach out to somebody who can help you, a naturopathic doctor, a functional medicine doctor who can at least give you some guidance in that area.
Mhm. That's a great suggestion. Yeah, absolutely.
So along with the whole stress thing, can stress from like narcissistic abuse and hostile custody cases cause inflammation in the body? I know
Oh,
stress can
absolutely.
cause that, and then like the brain gets inflamed. Does that create chronic disease?
It certainly can if it goes on long enough. Yeah. Yeah, the stress is very degrading on the body. It's a very catabolic process. It's breaking down things in your body. Um, and we need time to rest, to rebuild. We need time to pick up enough micronutrients for the tools to rebuild. And then we need to put the stress hormones away for a while so the immune system can help with the rebuilding process and fight off anything that's been lingering. Because when we're suppressing the immune system that long, we're also missing chances to kill cancer cells. We're missing
Mhm.
chances to suppress viruses and bacteria. So these things are all kind of bubbling under the surface, trying to take their opportunity while you're under stress. So,
Mhm.
so it's definitely possible that you could end up with something uh, down the road. But
Yes.
most
Yeah.
of the time, once you've cleared that hurdle, most of the time the body can rebound pretty
Right.
well. Yeah.
So, random question. When people come out of a stressful relationship, sometimes their memory is not great. Is
hmm
that, can that be correlated to like the stress, in fact, affecting the inflammation, which affects the brain and the memory?
Yeah, that's probably more related to the lack of sleep and the lack
Yeah.
of quality sleep. Your REM cycle is going to be affected by that, so you're not consolidating memories. So that's probably where that's coming from. And maybe at a certain point, it could be protective if there was a really bad abuse going on. So that, could be helpful to an extent, but also it can be distressing knowing that, like, oh my gosh, I'm forgetting stuff. And you might just be forgetful in the moment all the time. Like, forget your phone, leave your keys somewhere. Those lapses in focus, that's just typical stress and lack of sleep issues generally.
Yeah, there's a lady that I follow who was talking about how she's on a vacation with her kids and her kids brought up something about something they done in the past and they're like, "You don't remember that, Mom?" And she was like, "No." She said that she was in such a terrible situation, and her brain, to protect her, blocked out the bad stuff, but and also blacked out some of the good stuff.
Yeah.
Yeah,
Is there a way of protecting yourself against that, or that's just the brain saying,
Yeah.
brain.
Yeah. I don't know if you can selectively choose what you're going to forget, unfortunately. That would be nice.
that would be nice,
I was
wouldn't
going to say from personal experience, I do think those memories sometimes come back over time. Sometimes it's a couple years, sometimes for certain things. I can't go too much into my situation, but it definitely really it took some time. Lots of, going through pictures and things like that is very helpful.
Yeah. And I would say probably hypnotherapy can be good there
Mm-hmm.
too.
Mm-hmm.
Yeah. Hypnotherapy. And of course, I'd be remiss if I didn't mention EMDR
Yes,
uh,
which, yes,
for
I know.
stress. Yeah.
And
Mhm.
you've done that before, have you? I think you tried it at
Personally,
once.
I've tried it, but I tried it during the pandemic, and so
Oh
all that was
yeah, you
available
need a
was like
fresh start.
online. Yeah, you need in person for that.
Yeah,
you? Yeah.
But
absolutely.
the idea there is that somebody's making you look back and forth, and they have you follow a thing, and essentially that's sort of mimicking REM sleep because our eyeballs
Mm-hmm.
are moving back and forth during REM sleep. So you work with a therapist, bring up something traumatizing that you might have been blocking out, and you're following this thing and essentially processing that in real time. So it's got to be under really careful conditions with a trained therapist, but it can help you sort of process those demons a little bit and get past it so that they are not so emotionally reactive to you and you don't have it. It really disarms the triggers.
Yeah.
And long-term stress, like from abuse or just any stress in general, can that lead to mental issues such as depression, anxiety, dementia, Alzheimer's?
Well, so put the last two aside for a moment. Those are more organic diseases, but definitely, yes, trauma of any kind can lead to depression, anxiety, panic disorders for sure, in the long run. And that's where good quality therapists should come on board. That's where the EMDR can be helpful to really process that. Um, these are all these things. The trauma, it often just kind of hides in the background, just
Mm-hmm.
tainting your life a little bit. And so really confronting that with a trained therapist is really going to be the way to go there. As far as down the road leading to dementia and Alzheimer's, I don't think that's necessarily true. Um, with severe depression, that can lead to dementia. Alzheimer's is a whole other thing,
Mm-hmm.
more related to metabolism than it is to something you were thinking about. But with regular old dementia, depression, we know lessens gray matter in the brain, and so when that happens over a long enough time period, you can end up with some what looks like dementia.
Mm-hmm. Mm-hmm.
But that's later, and you've got plenty of time to sort of course correct, by then.
That, yeah,
Yeah.
that's awesome. Yeah, I didn't know that metabolism was. Gotta nerd out later.
So, what about like the vagus nerve? Can you tell our listeners a little bit about that and how that can help with stress and deregulating, like when you're
Yeah.
deregulated?
Yeah, so the vagus nerve is one of our cranial nerves. It's one of the longest ones, if not the longest one, actually. So it goes all the way from the brain down to the gut. And it's essentially an autonomic nerve, so it's
Wow.
responsible for rest and digest. And so it's more in the parasympathetic nervous system. So when it's activated, presumably you're just in a relaxed state. You're able to digest and extract nutrients from your food. Um, but when there's vagus nerve dysfunction, that's going to cause a whole host of issues,
Mm-hmm.
particularly with digestion, regulating heart rate, things like that. Um, and so, as far as specifically treating it, I would say it's more a secondary result of treating it.
Mm-hmm.
And getting it better will help you with your parasympathetic nervous system. Because when you're stressed and you're in fight or flight mode, that's when the sympathetic nervous system's taking over and suppressing the parasympathetic. And so you're not able to rest and digest. It's basically kind of the overarching tone of what we've been talking about this during this podcast. And so you really want to prioritize rest and digest.
Mm-hmm.
ultimately.
Mm-hmm.
Yeah. Yeah.
So we went over one more. We've got a question on red light therapy.
Yeah.
Yeah. Does that help with stress and depression caused by some emotional abuse? I know the physicality things that it brings.
Yeah. Red light therapy is more generally considered a physical therapy.
A cosmetic.
Um, yeah, it does penetrate the skin to an extent, but
Okay.
it's a signal to your to your cells basically to induce a healing response.
Okay.
The specific frequency they use in red light is a signal to the cell to begin reparations, basically. Uh, and so I guess if you could bathe your brain in red light, maybe, but I don't know if that would. Yeah, I don't know if
They'll be
that would
just
actually help.
stay tuned next year. We'll have some. I'm just
Yeah, right.
gonna QVC will be getting all those old gals going and um okay.
Can things like the keto diet or fasting, can those help with inflammation from chronic stress?
Yeah, they definitely can, but I would say that you should not do keto or fast when you're in when you're in a stressed out state like that. If you're very taxed and you're very just basically living on fumes, you don't want to be testing out new diets, particularly keto. Keto is actually a very stressful thing to do to the body. So while it does produce some good results, it's good for people with pre-diabetes,
Mm-hmm.
and it's good for just regulating metabolism.
Mm-hmm.
I would consider it more in the exercise category. And so if you don't have the reserves to do that, you should not be doing that. You should also not be doing it if you have any heart conditions and stuff on the heart. Um, and then fasting in general, again, the goal here is that you're you're wanting to support the body where it needs, and fasting is another one of those stressful states.
Mm-hmm.
So you can't be adding a stressful state to an already stressed out state. It's not gonna go well. Yeah.
Earlier we talked about foods that are good for you. What are some examples of things that you should avoid
Mm.
that can be stressful to the body or cause
Yeah,
inflammation?
yeah. So I would say definitely the low-hanging fruit here would be processed foods, you know, low quality oils, sugar, and alcohol. I know that people usually reach for alcohol when they're stressed, but that's just really going to deplete your neurotransmitters. It's going to deplete your nutrients,
Mm-hmm.
and it's going to leave you just in a way worse state than if you'd had any at all. Um, I know that people are out there using cannabis more these days. There's probably some use cases for that, but of course, in moderation is going to be the best there, um, and probably the lowest dose that you can
Fine.
tolerate. Yeah, that you can find would be best. Um, and there is some science showing that cannabis can help keep cortisol around a little bit longer. So if you are experiencing, now this is not medical advice, of course, this is an illegal
Oh no,
substance,
this is yeah, no, you're not giving
but
full advice.
yeah,
There's been
so
discussion
but
for
the research shows that THC does help cortisol stay in the system a little bit longer.
that's
So if
interesting.
you are completely depleted in cortisol, it can help with that. But of course, when you're in an extremely stressed out state, it's really just best to do it completely substance free,
Okay.
and rely on your food, nutrients, water, hydration, all that. Exercise, light exercise, is going to be the best there.
Awesome.
Yeah.
Do you know if stress affects women differently than men?
Um, well, now we can have a whole topic on sex hormones. But yeah, basically, you know, if you're stressed as a woman, it's probably going to impact your menstrual cycle. You may miss your period here and there, which of course can be scary depending on what you're going through.
Right.
So just know that stress definitely can have an impact on your cycle. It can make you early, it can make you late, it can make you miss it entirely.
Mm-hmm.
Um, and if you are trying to conceive and you're in this situation, of course, that's going to be very difficult. Um, and then for men, it's going to be very difficult as well to maintain your testosterone levels.
Mm-hmm.
When you're not sleeping well, when you're stressed out, it's going to suppress the release of LH and FSH. Um, which is actually the same in women and men. So it's going to, for men, present as it's going to reduce your sperm count, it's going to reduce your testosterone levels, and then reduced testosterone levels are going to make you feel anxious and nervous just from that alone. So it's this whole cascade of suppression of bodily systems. And then when women have reduced LH and FSH, they're less likely to release an egg and have a period. So that's where that comes from.
Do you recommend things like testosterone replacement or
Yeah, there's
testosterone
definitely
therapy?
a case for that. There's definitely a case to be made for that. Of course, you want to get tested and follow it with a physician who knows what they're doing. But I have guys like that all the time. I have patients who are
Mhm.
recent divorcees. They're dealing with a lot. Their testosterone is tanked. Usually, the first thing they notice is the lack of morning erections, which is a
Mm-hmm.
normal thing for men.
Mm-hmm.
And when that's gone, you just feel low and depleted throughout the day.
Mm-hmm.
Um, and so getting tested for that's a good way. And this is usually something when you're in the rebuilding phase, right? And when you're trying
Mm-hmm.
to get through it. Although testosterone probably would be helpful in the moment, so there could be a case for that.
Mm-hmm.
Um, and same for women too. I have women on testosterone as well, and that
Yeah.
can give them the same benefits of motivation, better sleep, better energy, um, and better bone density. So if you're in your 40s and you want to get into your 60s with better bone density, a low dose of supportive testosterone can really go a long way.
Yeah.
Um,
Yeah.
and then on the other side of it, once you're in the rebuilding phase, consider like, well, I guess even actually progesterone could be helpful during that time to help you sleep.
Mm-hmm.
So
Yes.
overall, a hormone panel would be good to know, and then follow with a doctor who can treat you.
Awesome. Awesome.
Mhm.
Well, let's see. Let's go ahead. If we wanted our listeners, where can we find more information about you and how can they contact you? What's your social media look like? And
Yeah,
for our listeners, we will have this on our website as well. But
yeah. So I'm pretty much on every social, Instagram, Facebook, YouTube, TikTok, under Dr. Michael Morse. That's Dr. Michael Morse. And you can also find me on my website at www.ndondemand.com. That's ND as in like naturopathic doctor. And that's where my practice is. So I see patients on there. I practice primarily in Arizona, but I'm happy to have consultations that are generally more educational and lifestyle based, and diet and lifestyle, for anybody in the world.
awesome. Well,
Yeah,
thank you so much, Dr. Morse. We learned so much.
absolutely. Yeah, it's a pleasure being here. Thanks for having me.
Thanks.
Talk soon.